So in this unit, we're going to discuss how to assess running mechanics. Now, you could have a course on its own on running mechanics, its analysis and its intervention, but in relation to the big three, what are the main factors that we as clinicians involved in the rehabilitation of these athletes need to assess and identify in order to be most successful in our outcomes? We need to think about the three main mechanisms of injury. We know that soft tissue injury and tendon injury can occur during steady state running, whether that's continuous high intensity running or low level jogging. We know it can occur during acceleration maneuvers, and we also know that it can occur during maximal activities such as high intensity sprinting. What we need to consider is, from a running analysis point of view, the stage of rehab. When is it appropriate to start reintroducing running analysis? And what speed are we going to influence them? And will that speed of running influence the mechanics that they demonstrate? Are we going to examine them on a treadmill, where obviously it's easier because they're in a static position in terms of filming and analysis? Or are we going to do across ground or out on the grass or on the court, which obviously has greater ecological validity to the sport that they're returning to? Are we interested in performance metrics in terms of ground contact time, the level of speed that they can tolerate, or the distance covered? Or are we interested in biomechanics, how they're executing running at any given point in time? And what method of analysis are we going to use? Are we going to look at just purely performance metrics? Are we going to use videos to look at 2D analysis? Or are we going to use a biomechanics lab to look at 3D biomechanical analysis? So when we're examining running mechanics, as I said, you could spend at least 2 days talking about the development of running patterns and what to look for. But what are the main components we're interested in? Well, there's three main stages of stance that we want to examine. Of running that we want to examine. Number one is mid stance, which we'll examine in the frontal plane and the sagittal plane. Number two is toe off, in particular in relation to pelvic control and ankle control in the sagittal plane. Also, initial contact, or how much overstride we have. And in relation to excessive rotation, very often that will become exposed, or deficits will be obvious during the swing phase of running. So again, it's mid stance, toe off, initial contact, and swing phase are the various phases we want to look at. And in terms of what view to examine these from, the frontal and transverse plane are best examined from behind, or for the transverse plane from in front, and the sagittal plane is best examined or videoed from the side. So if we start with the frontal plane, our number one point of reference is mid stance. So you can record someone running and slow it down to examine what they look like in mid stance. What we're interested in is how they look in the frontal plane at the trunk, so much trunk side flexion, at the pelvis, much pelvic drop, and at the foot and ankle in terms of much hip adduction, internal rotation, and foot pronation. We're seeing much deficit side to side, and much deficits compared to more athletic athletes or better athletes that we have from our reference stock. So in relation to frontal plane analysis in the mid stance, how much asymmetry is there in trunk side flexion, how much deficit is there in pelvic drop and in hip adduction, and also in relation to foot pronation in mid stance. Not only can we look at this in steady state running, but we can also examine it during acceleration. So if we play this video in normal speed and look at the difference in relation to his right and left side, again, we're looking for asymmetries in trunk side flexion. You can see the greater trunk side flexion during the left stance phase, the magnitude of pelvic drop, the degree of hip adduction and knee external rotation, and again, how much pronation there is at the foot during mid stance and during toe off. We can move on then to the transverse plane. One of the main factors we're interested in is above and below the waistline. So below the waistline, how much crossover is there of the feet from one side compared to the other? Again, you see here the left swing leg pulling through fairly clearly, but the right swing leg swinging out behind them. Similarly, we can have a look at the shoulders. How much asymmetry is there of arm swing one side compared to the other? You can see how he holds his right elbow out at a different angle, and most of the rotation is happening at the trunk. It's not happening at the shoulder joint in one side, at the shoulder joints one side compared to the other. So in the transverse plane, we're interested in, is there an arm swing or trunk swing, and how asymmetrical is it? How much trunk rotation is occurring, and how much leg crossover is there one side compared to the other? As you can see, the greater crossover of his right leg during swing phase. And then we come to the sagittal plane. We're interested here primarily in how flexed is their running posture, how much anterior pelvic tilt is there, and as we said earlier on, how much do they collapse during mid stance. We talked not only about that anterior pelvic tilted position, but also the degree of overstride as we step forward one side compared to the other. We want to see, can we have a relatively tall, neutral upright posture, a relatively neutral lumbopelvic position, and good swing leg recovery. So to take you through each of these, ideally in mid stance, we're looking for a figure of 4. So you can see the picture of the female athlete, how the swing leg has come past the stance leg at mid stance. So that means her swing leg is recovering in time, not to have to overstride. We're looking for the degree of anterior pelvic tilt. We can see greater anterior pelvic tilt in the male athlete, and how much flexion there is at the ankle and at the knee joint. We can look then that if there isn't that sufficient figure of 4 or sufficient swing leg recovery, how much overstride is there going to be as a consequence. You can see the female athlete landing with a more vertical shin, minimal contact of the ground in front of her center of mass, and quite a neutral shin angle in comparison to the male athlete. And we can also look at toe off. Again, how much arm swing is there as opposed to trunk rotation? Is she able to maintain that neutral lumbopelvic position? And looking for that positive thigh angle as she looks to have optimal swing leg recovery to strike down on the ground as efficiently as possible. So when examining running mechanics, how are you going to assess them? Is it treadmill? Is it grass? How are you going to influence the speed that they run at and keep it consistent for assessment and reassessment? You want to break the running mechanics into the various stages. So mid stance, toe off, initial contact, and examining those transitions during swing phase. And understand that all these various components can be different from athlete to athlete and how they relate back to the pathomechanics of the particular injury that you're looking to rehabilitate.